This conference will now be recorded.
Hello, everyone. Welcome. My name is Jennifer Wang, President of Paradigm Medical. We are a Canadian medical products distributor specializing in post-mastectomy, lymphedema, and orthopedic foot care solutions. We are dedicated to bringing Health Canada licensed medical products to underserviced markets across Canada. For over 30 years, we have proudly served as Canada's exclusive distributor for trusted brands like ABC, Biocompression Systems, and our lines of orthopedic medical grade footwear and foot care. Today, Paradigm Medical is thrilled to be hosting an in-depth clinical session on the topic of addressing the burden of radiation fibrosis in breast cancer patients. We are incredibly privileged to have guest expert, Dr. Crystal Champion, joining us. As a doctor of physical therapy, a certified lymphedema therapist, and a breast cancer survivor, Dr. Champion brings an invaluable dual perspective to patient care and clinical assessment. Joining her is Coco Burt, product manager for ABC, who will help us explore some of the most recent product developments to help address this condition. We will be opening the floor to questions at the end of the presentation. Please submit your questions using the chat app. If you have any questions, it looks like a two little dialog box at the top right-hand corner. So thank you everyone for being here today, and let's get started. With that, I will pass it over to you, Dr. Champion.
Thank you so much, Jennifer, for collaborating on this webinar today. Just a little bit about ABC. We are dedicated to helping women lead fuller lives after breast surgery. We've been around for 23 years. We are one of the leaders in the post-mastectomy space. And we are in over 30 countries with distributions, and we have 8 patents as we are continuously innovating to provide comfort and effectiveness to patients. So today's outline, we'll talk about fibrosis, we'll talk about truncal lymphedema, we'll go over some assessment and treatment techniques, as well as introduce you to ABC solutions. So what is fibrosis? So fibrosis is an excess formation of thickened tissue. So when healthy tissue is damaged, it becomes replaced by hard, dense, and thick fibrous tissue, and it's more likely to become severe if it's untreated or inadequately managed. So common types of fibrosis in breast cancer patients that can be caused by damage from chronic inflammation, injury, or disease includes cording, capsular contracture, fat necrosis, surgical scarring, radiation-induced fibrosis, as well as lymphostatic fibrosis. With radiation-induced fibrosis, it is a very common and disabling condition in breast cancer patients that is characterized by an abnormal and excessive formation of fibrous connective tissue. It can have a delayed onset, beginning 4 to 12 months after the conclusion of radiation, and it can also have continuous development, and sometimes the effects and the symptoms of radiation-induced fibrosis can progress through many years. Radiation fibrosis affects skin, underlying fascia, muscle, organs, and bones, and can lead to structural and functional changes, such as decreased joint range of motion, lymphatic and vascular dysfunction, pain, breast hardening, as well as breast retraction and fixation. There are several risk factors for the development of radiation fibrosis, and breast cancer patients who are at low risk for development include those who are young, healthy, active, with a BMI of 25 or less, non-smokers, limited alcohol consumption, no cannabis use or recreational drugs, those that have lumpectomy with or without a sentinel lymph node biopsy, no systemic therapy for breast cancer treatment, and then those that have radiation therapy to the breast only. Those breast cancer patients at high risk for developing radiation fibrosis includes those who are older, with age of 60 plus, those that have multiple comorbidities, those that are inactive, BMI greater than 35, tobacco and cannabis use, those with mastectomy and reconstruction and axillary dissection, delayed healing, chemotherapy, and tamoxifen, and then those that have radiation therapy directly to the breast mound and the lymphatics in the axillary area. So radiation-induced fibrosis can have an impact on quality of life. So you have emotional impacts, which include emotional distress, fatigue, negative body image. And then you have physical impacts such as pain, impaired activities of daily living and instrumental activities of daily living performance. You have range of motion and mobility restrictions, and it can cause improper fit of clothing and bras. So another impact of radiation-induced fibrosis is the development of truncal lymphedema, and we'll go into more specifics with this. So breast cancer treatments can lead to mechanical insufficiency or poor functioning of the lymphatic system. So for example, radiation fibrosis can cause scarring that can cause compression of the lymphatic vessels. Radiated lymph nodes can lead to blockage of lymphatic passage secondary to fibrosis in the lymph nodes. Lymph node dissection can interrupt the lymphatic passages. And then surgical scarring that's caused by post-surgical trauma and inflammation can also cause poor functioning or improper functioning of the lymphatic system. So truncal lymphedema refers to swelling that affects the trunk or upper body, and the areas included are the shoulders, the chest, the breast, abdomen, axilla, and the back. And there is a 70% incidence rate in patients being treated for breast cancer who are at risk for developing truncal lymphedema. And again, it can be caused by surgery, chemotherapy, radiation, or tumor in breast cancer patients that are, again, causing blockages or improper functioning of the lymphatic system. So truncal lymphedema can present differently in different areas of the body. So the picture to the far left is a presentation of what it can look like in the breast. The middle picture shows what it can look like in the posterior trunk. So on the left side of her trunk, you can see the fullness compared to the right side. And then in the chest wall and axilla area, you can see a buildup of fluid in that last picture. So in terms of specifically development of edema in the breast after radiation, there's different rates of development. So swelling in the breast is highest risk of development at 6 months post-radiation due to the initial inflammatory response. And then it's lowest at 18 months post-radiation due to the body has gone through tissue remodeling and fibrosis development has stabilized at that time. And now we'll go over some assessment and treatment techniques for evaluating fibrosis and truncal lymphedema. So to begin screening for truncal lymphedema, it is often hard to identify truncal lymphedema. So it's recommended to assume truncal involvement if you notice that upper extremity lymphedema is present, such as the arm. So arm lymphedema is a good indication for clinicians to take a closer look to evaluate for swelling in the trunk. Some signs and symptoms of truncal lymphedema include aching, heaviness or fullness, numbness, pain, redness, swelling or puffiness, tenderness, tightness or firmness, tingling, warmth, stiffness, limited arm and shoulder mobility, changes in broadband and cup size that can cause skin indentations. And at ABC, we developed a truncal lymphedema symptom screener. There is currently no gold standard of assessment for truncal lymphedema. So we developed a truncal lymphedema symptom screener to help guide clinicians during the evaluation process for key symptoms that they should look for that patients may not be so readily able to report. So the gold standard of treatment for lymphedema and also truncal lymphedema is complete decongestive therapy, and has 4 components in 2 phases. So we have manual lymphatic drainage, and where we're rerouting the lymph fluid around the blocked areas. There's compression bandages and garments to help with fluid reaccumulation and to improve venous and lymphatic return. It also helps to break down and soften scar tissue and fibrosis. You have exercise, which helps to increase lymph circulation, and then proper skin and nail care to reduce risk of infection. And so with complete decongestive therapy, you have your phase 1, which is your intensive phase or your reduction phase. So the goal is to reduce the swelling as much as possible. And then phase 2 is the maintenance phase, in which you're maintaining the reduction achieved in phase 1, which a lot of patient self-education and self-management comes into play. In dealing with assessing fibrosis, there are some key techniques to keep in mind. You want to do visual assessment and palpation. You can do fibrosis measurement and scoring. You can also take photographs for comparison. And then you can also do functional mobility testing, such as muscle length, range of motion, strength, as well as postural assessment. So I just want to go over a few of these assessment techniques in detail. So you can use a skin caliper to assess for fibrosis. You want to compare the affected side to the unaffected side. So if you're looking at fibrosis specifically in the chest, you can look at the diagonal fold, 1/3 of the way between the upper armpit and the nipple line. And in the mid-axillary area, you can go towards the horizontal fold directly below the armpit. And as a general rule, areas with fibrosis can be harder to grip with the skin caliper and may yield a higher measurement compared to an area without fibrosis present. So these are just some general guidelines of anatomical points that you can use to assess with the skin caliper. Delphin has a skin fibrometer that is used to objectively measure fibrosis. So the fibrometer measures tissue resistance to pressure, skin tissue firmness, tissue induration and indentation, and it's also non-invasive and user-friendly. So you literally take the probe and touch it on the various areas of the body where you want to assess if fibrosis is present. It can be used on various areas of the trunk, and I always recommend whichever areas you choose, make sure to document those areas and be consistent when you're comparing your measurements from, pre-treatment and measuring the progress through treatment. So the more fibrotic the tissue is, you're going to yield a higher force measurement with the reading of the fibrometer. Fat necrosis is another form of fibrosis in breast cancer patients. And some of the causes are the inflammatory process caused by damaged tissue cells that's replaced with firm scar tissue. You usually see higher incidences of fat necrosis with autologous flap reconstructions, such as your latissimus flaps, your deep flap surgeries, and areas that have poor blood supply after breast surgery. So some of the symptoms of breast fat necrosis include nipple retraction. It may look red and bruised. There can be skin tethering or dimpling. It can feel like a hard round lump or a thick section of skin. And then it can be usually painless, but it can be painful or tender depending on if it's affecting or pressing on any nerves in the surrounding area. And what's interesting about fat necrosis is that sometimes it can be confused with actual breast cancer recurrence. So most women who present with fat necrosis, they usually have to undergo breast imaging or breast ultrasound to determine if it's just scar tissue fat necrosis versus an actual breast cancer recurrence. So some treatments for fat necrosis can be gentle breast massage. There's over-the-counter pain medications that can be used. And then there's also surgical removal if the area of fat necrosis is very large and causing pain and discomfort. capsular contracture is another common form of fibrosis in breast cancer patients. So this occurs when radiation accelerates the formation of fibrous tissue around a breast implant. So some symptoms of capsular contracture include a breast that feels firmer, tighter, or harder than usual, one breast that sits higher than the other. There can be tightness, discomfort, or aching in the chest. There can be visible rippling, asymmetry, roundness, or distortion of the implant compared to the opposite side. And some treatments for capsular contracture include anti-inflammatory medications that can help reduce the inflammation and the scarring process associated with capsular contracture. There's ultrasound or shockwave therapy that can be used to soften the fibrotic tissue. Compression, we know it helps to break down fibrosis and hardened tissue. Manual therapy techniques with physical therapy. And then in extreme cases of capsular contracture, sometimes surgery is warranted, whether it's through a revision of the implant or a capsulectomy, in which that fibrous capsule is actually surgically removed from around the implant. Capillary web syndrome is another form of fibrosis associated with breast cancer treatment, and it's also known as axillary cording, and it's caused by local injury to the lymphatic system. It occurs after breast cancer surgery, including sentinel lymph node biopsy or axillary lymph node dissection, and cording can be present in the axilla, arm, or trunk. And it is described as a breaking or tight sensation under the arm with reaching above shoulder level or overhead. I actually have cording right now, and I'm actually in physical therapy for this. So I can attest to how uncomfortable and how limiting it can be to arm and shoulder function. So we'll talk a little bit later about some techniques to help with axillary cording. That's very common in breast cancer patients. So some treatment techniques for fibrosis. There is low-level laser therapy. So there's the RheinCorp LTU 904 low-level laser. It is a handheld device. It's non-invasive. It penetrates the tissue to stimulate cellular activity. It helps to reduce inflammation, and it can help promote tissue regeneration. It reduces scar tissue, improves tissue mobility, and improves inflammation. It also works well for cording present in the axilla and trunk. And so what you do with the laser is there's a little timer on there. You press the button and you hold the laser against the skin in the areas of fibrosis that you want to treat. And then when that timer is up about 30 seconds or so, you just gently move the laser to the next area of treatment the next area that you want to have treated. And the tissue depth for the laser, in the picture that you see, you can see the different wavelengths for lasers, so it can show you the depth of tissue penetration. And so with that 904 laser, you can see it's going to fall between that 740 and 1000 wavelength. So you can see it kind of goes all the way down to that subcutaneous fat layer of the skin to help break down fibrosis and scar tissue. And it's not painful. It doesn't heat the skin in any way. It's very gentle. To treat fibrosis, we also have negative pressure therapy. So there's different forms of negative pressure therapy, such as cupping or the Lymphetouch system. These two can promote oxygenation and lymphatic drainage of the treated area, and can also help to improve tissue appearance. So negative pressure therapy can stimulate lymphatic flow by the dilation of lymphatic vessels. They can gently lift and release scar tissue to reduce adhesions, which will also help lymphatic flow. It increases tissue flexibility and extensibility, and can also help to reduce pain and inflammation. Also with the Lymphetouch, you can add a vibration component to it to help break up scar tissue. So vibration, in addition to the negative pressure therapy, can help to kind of help with the restructuring of the tissues a little bit more to really stimulate the lymphatic flow. And of course, we have myofascial techniques that can help to treat fibrosis. So these can be integrated into your treatment to mobilize tissue to improve lymphatic drainage, relieve stiffness, and improve range of motion. So you have instrument-assisted soft tissue mobilization, in which you can use different tools, angles, and pressures to target different tissue layers. You have your manual techniques such as cord bending for axillary cording. There's manual myofascial release. You can do skin traction techniques, and then you can also do scar massage to help relieve some of the scar tissue. There's exercises that can be integrated with the myofascial techniques, such as stretching for the front and lateral chest wall, axilla, and shoulder. And I always say to be cautious of healing times, any open areas of the skin, any unhealed areas, and avoid being really aggressive with your myofascial techniques, just so that you don't treat too aggressively and induce inflammation that could lead to further inflammation and more swelling if the patient has truncal lymphedema. Another treatment for fibrosis is dry needling. So dry needling is the insertion of a filiform needle. So it's a really thin, tiny needle, very similar to an acupuncture needle, that is inserted into the target tissue for therapeutic benefit for treating movement dysfunction, trigger points, and pain. So it can help to mechanically break down excessive collagen deposits when you're looking at scar tissue and fibrosis. It can help to improve blood flow for tissue healing and to reduce buildup of fibrosis, and also helps to break down fibrous adhesions to improve range of motion and to reduce pain. Intermittent pneumatic compression pumps are also available to help treat fibrosis. So these can help to soften the fibrosis as well as manage the truncal lymphedema symptoms. So prescription is required. The biocompression systems is available and is Health Canada licensed. It's also eligible for provincial or private health insurance. And our partner, Paradigm Medical, is a Canadian distributor for these biocompression systems. Next, for fibrosis treatment, we also have lymph pads. So these help to soften fibrotic tissue and facilitates lymphatic drainage. So lymph pads can be used in conjunction with compression garments. There are various shapes and sizes to help target different treatment areas. They're usually made from foam and fabric, and there's different channeling for directional flow, varying densities and thickness for treatment.
All right. So how does ABC address these conditions in the breast cancer patient population? Dr. Champion just showed us some extremely impressive tools and technology to manage these symptoms. So we want to show you how ABC comes into the play. So as she just showed you, the lymphedema pads, some of you may be familiar with these products, maybe not. If you're not, the lines that you see on all of these foam products typically mimic the treatment components from manual lymphatic drainage. So you can see Kelly at the bottom. She is a physical therapist who has a YouTube channel with lots of instructional videos. She is demonstrating how to do MLD across the breast tissue. And you can see she's using her fingers to help manipulate the tissue to encourage lymph transport. Essentially, that's what these channels are doing in the foam pads. So some of these foam pads have channels, but they have a lot of bulk. Some of these pads are really thin, but they only have texture and they don't have channeling. So, next slide. Why don't we have a way to tie in channels with texture and a low profile undergarments? It would be the ultimate combination to manage symptoms, as we know when things are bulky or someone is self-conscious about wearing it, their compliance will drop off. Fortunately, we have that solution, Lymphy. a cool new way to treat lymphedema and fibrosis. This is our newest product line that we'll talk you through today and answer any questions you might have about it. So Lymphy is our newest product line that continues to meet the needs of women post-mastectomy. Since complications like lymphedema and fibrosis are unfortunately conditions that appear after surgeries and cancer treatments, this new patent-pending product is something that we are super proud to bring to life. It's the newest innovation to pressure pads. This specific product that we're looking at here is called the Groove Pad. It comes in one size, one color, and it has a very unique shape so that you have a little bit more freedom with where you can place it. So let's go over some of the feature and benefits of this product. Dermal stimulation. Since it is a silicone product, the silicone has this innate grippiness to it. So when it's on the skin, it kind of sticks to the skin. And the channels that are built in help to facilitate lymph movement, kind of like the friction between fingers and skin. We're getting that with the silicone pad supported against the skin with a compression garment. It's also very, very cool. If you can see, there's a bunch of holes throughout the product. We call this the 3D lattice. This is one of our claims in our patent. This kind of construction effectively increases airflow to wherever the pad is resting on the body. We actually conducted a test against 5 leading lymphedema pads, the Jopes, Jovipac, Mobiderm, the Swell Spots. There are a few other products from overseas that we tested it against, and ours outperformed all of them tremendously with air permeability, which is essentially the ability for air to move through the product. And as we all know, a lot of women get propelled into menopause or have hot flashes from the treatments. So coolness is key for patient compliance. Another feature that we like to point out is the micro massage. So that 3D lattice that allows for coolness also provides varying high-low pressure points to soften the fibrotic tissue. So if you're familiar with the cherry pit packs, and some of the foam pads have varying densities throughout to help soften up that fibrotic tissue. And then, as I mentioned before, it has a very unique shape. So the placement is super versatile. We have a lot of people that put it under the arm, but I've also had participants in our wear test program that have worn it around their neck, the back of the knee, across breast tissue. I always like to call out, when we were developing this product last year, I was a pumping new mom and I was getting clogged ducts pretty frequently. And I decided to test this out on myself. So I put it in the fridge one night because I knew I was going to have clogged ducts in the morning. I woke up, put it in my bra, went to the gym. So just a regular sports bra, actively going somewhere where I knew that I was going to sweat. Number one, you couldn't tell that I had anything on underneath my bra. Number two, I forgot I was wearing it. And number three, it's helped soften the clogged ducts. I forgot I was wearing it, so much so that I didn't realize it until I took off my bra to shower and it fell to the ground. So we think that this product is so revolutionary for this breast cancer space, but also for many other lymphedema and fibrosis patients. Okay, so let's look into a little bit more different placements on the body. So we have the posterior trunk or the back. We know sometimes there's frequent swelling around the scapula. Of course, the axillary area, lateral chest. This is probably the most popular area that I hear complaints and discomfort. And then the chest and the breast. So I use it on breast tissue, but you can also use it right up against the skin on the chest if there is no breast tissue remaining. So I mentioned this, but just want to show you the picture of the side view of this product. Because the edges are so thin, it blends right into the skin. So the edges of the pad taper out so tiny that when you put it up against your skin, it doesn't poke out like the foam and fabric pads do. Sometimes people will say, it looks like I'm wearing an oven mitt, but with this product, it is a seamless transition into the skin, and it pairs really nicely with our ABC truncal compression garments that Dr. Champion will get into a little bit later. Another notable feature about this product is that it is the only 100% silicone pressure pad on the market. Like I mentioned, it is patent pending, and there is truly nothing like this that you can compare. You might be familiar with another pad that has some silicone in it, but this is the only 100% silicone pad. Since silicone is such a durable material, the useful life of something like this, we say, is about 6 months, which is typical for a pressure pad. Perhaps even longer, depending on the care and usage of the product. So if someone is wearing this light compression and they're taking pretty good care of it, this could last a really long time. If someone is wearing it under high compression bandages or wraps and their dog gets to it or they're not keeping good care of it, potentially the lifespan of this would be about 6 months. Another concern that we heard from our Canadian friends is that there is concern about the bacterial growth in the groove pad. I mentioned there's all these tiny holes, and there's concerns like, aren't things growing in these holes? But like I said, this is 100% silicone. And one of the standout features of silicone is that it innately has a resistance to growing bacteria. And this is why it is so frequently used in medical devices. So it's actually quite a suitable material for a product used on compromised skin, which we see frequently in the lymphedema and fibrosis community. So I've been talking about how long this would last if you take good care of it. How do you take good care of it? It's very simple. You just need water, soap, and a towel. So for more imagery, I'll walk you through the cleaning process. Put your groove pad underneath water. Add gentle soap to it, so oil-free and fragrance-free soap. Massage the soap through the pad and rinse out the soap. Once you've rinsed the soap out, wrap it in a towel and squeeze it. So it's much easier to clean than a foam and fabric pad. You don't need a washing machine and a dryer. Typically with some of the foam pads, the dryer is not needed not only to dry the pad, but to re-fluff up the foam so that it's as effective as it needs to be. So imagine the inconvenience when you're traveling, you spilled coffee, makeup, or your kids spit up on the pad, and you need a washing machine and dryer to clean it. You're probably just not going to wear it for the rest of the trip. Again, compliance drops. Okay. So the cleaning is pretty straightforward. What you see is what you get with the groove pad. You don't need a dryer or any special tool to get this product back into the shape that it's intended to be. Silicone keeps its shape. It's durable. It's easy to clean. Bacteria will have an impossible time growing on this. We are so excited about this product. It's been on the market for about 3 months here, and we've had nothing but glowing reviews. To make the maintenance of this product even easier, we have included with every single groove pad a 12 by 12 towel. It's a quick drying towel, so it's really nice to use when you're traveling. They all come with a towel, an instruction booklet, and a little bit of a care card with the 3 steps: water, soap, rinse, and dry. We've had really great feedback about this product and the easy maintenance of it. It's just been really a wonderful experience. And I'll just let you know, when I was testing this last year, personally, I wasn't cleaning the pad and it didn't have any weird smells or discoloration. So if you have a patient where you're like, oh, I know she's not going to clean this every day, if she cleans it like once a week, once every 2 weeks, it'll probably still be okay. So I want to round all of these features and benefits of the groove pad into real world experience. And patient compliance is at the heart of it all. There may be some patients that for whatever reason can't use a compression garment, And in those cases, they could still use this product and get the benefits. Maybe not the maximum, but the results that you would get of this pad with a lighter, softer, stretchier bra is still better than not wearing anything at all. Connected to patient compliance is the coolness, easy to manage, it's comfortable to wear, seamless transition under clothing. It actually does something. Our patients that are writing into us are seeing improvements. It really is life-changing for many of these patients, and therapists are saying that is a game changer for their treatment plans. So just to tell the story even further, I want to share with you one of our wear test participants. We have been wear testing this for almost a year now. This is one of our therapists from California. She has a 40-year-old female, right breast cancer. She underwent neoadjuvant chemotherapy. She had a sentinel lymph node biopsy December of 2024. She had a radiation therapy about 3 months later in March. Then she developed truncal lymphedema 7 months later in October. The therapist recorded pitting edema in the right chest wall, 30 seconds of pressure applied, 2 minutes pitting edema. At the end of the wear test program, there was no pitting recorded, improved skin mobility, and improved range of motion. So the next slide, the patient shows us how she placed it on her chest wall underneath her compression garment. So you can see a real life placement, how this worked for the woman. And you can see the edges of this pad just blend right up against her skin. And it's so flexible that almost anywhere you put it on the body, it will flatten and conform to that body part. So every wear test program participant is required to keep a log. And I wanted to walk you through some of her logs. So this is the first week of her log. I highlighted one of the notes, but you can see she's giving it a 5 out of 5 every single day. It never makes me hot. So good during hot flashes, offers better compression. That's huge for a person to actually speak to the hot flash. And then her midweek or her mid-program journal. I show you another. Here we go. It's comfortable. I'm noticing less pain in my side. And then her final week of the wear test program, you'll see she's not even wearing it every day. Comfortable, noticing I'm not meeting the insert. So she starts to taper down how many hours she's wearing it. So in the beginning, she started wearing it only a couple hours a day and increasing it as she got more comfortable and she knew that she didn't have any skin irritations. And then once she felt like improvement was happening, she slowly started to taper down, of course, with the instruction of her therapist that was monitoring this wear test. So I'll hand it back over to Dr. Champion, who will talk us through ABC's compression garment offering.
ABC, we offer 6 different truncal compression bras that are instrumental in helping to manage truncal lymphedema, and then with the compression to pair with the groove pad to help manage fibrosis and scar tissue. So they can all be used for daytime or nighttime compression. They all come with pockets to support breast forms or shapers, or just pairing with the pad of your choice. They're all with breathable fabric. And then there's different levels of compression depending on the level of severity of swelling, lymphedema, and fibrosis that your patient presents with. And then as you can see, 5 of these garments are, they qualify with the Assisted Devices Program of Ontario. And then the compression scale that you see at the bottom is relation to only ABC garments and not to other manufacturers. So you can see under each bra, it kind of shows you the targeted area of compression for that particular bra. So for ABC truncal compression garments, all of them do require a bust and an under bust measurement for sizing. Some of our bras do come in band and cup size, which is really amazing when you're trying to get a more accurate fit for your patients. And this is just an example of this size chart. So some of our bras are small, medium, large, extra large sizing. And as I said before, some of the bras are band and cup size, ranging from 32 AA all the way up to 56 with a cup size of FG. So you can fit a wide variety of patients with the garments available through ABC. And again, the size chart will depend on the bra that you're selecting for that patient. ABC also has massage breast forms that can help manage truncal lymphedema and fibrosis. So these are just a few examples that are available through Paradigm Medical. These all have patented massage back designs. As you can see, some of the forms have channeling built into them that can help mimic the channeling that you would get with a pressure pad that helps to encourage lymph movement and massaging of breast or chest wall tissue. The way they're designed, they promote airflow for improved coolness and comfort. And they can also be worn directly against the skin or within the pocketed bras. And as I mentioned before, all of those compression bras, they do have a pocket to support these breast forms. And at ABC, we do have patient and clinical resources that are available through Paradigm Medical. So I'll just kind of give a brief overview. So these are available upon request, but we do have some tools that you can use in your clinics to help educate your patients. So we have a breast cancer related lymphedema guide that goes over lymphedema treatment, signs and symptoms. We have our brochure that goes over features of the groove pad. We have an overall breast cancer treatment guide that goes over different areas of compression, whether it be immediately post-surgical, into lymphedema maintenance, as well as to how our breast forms can fit into that continuum of care. And then we also have a breast cancer related lymphedema self-check. So it's a post-size card that a patient can take with her, and if she's having any symptoms of lymphedema, she would just check those symptoms off of the card. And if she's exhibiting any of those symptoms, it's a good indication that she should ask her medical team for referral to physical therapy to have these symptoms addressed. So in summary, management of radiation fibrosis following breast cancer treatment requires a multimodal, comprehensive, patient-centered approach that includes early intervention, which is essential for effective care. ABC solutions and clinical resources play a vital role in helping to manage radiation fibrosis along with its associated impacts, and can help to enhance treatment outcomes, improve quality of life, and reduce long-term complications. So at ABC, we are your trusted healthcare partner for breast care and truncal compression solutions, post-surgically and beyond. And then Jennifer, I'll hand it over to you.
Thank you, Dr. Champion and Coco. That was wonderful. We already have some questions, so why don't we just jump right into them? So just quickly to remind everyone, we did have a question as to whether or not the presentation will be available with respect to the recording. Yes. So for those of you who may have missed part of the presentation or would like to use it as a reference afterwards, absolutely, the presentation is being recorded and we will make it available to everyone afterwards. Steph also had a question in terms of the LymphePad. Is it available in Canada to clinicians and patients? 100%, absolutely yes. Paradigm Medical, we are the exclusive distributor. We will follow up with you if anyone is interested in seeing some samples or learning more. Mina, her email is info@paradigmmed.com. You can contact her directly or give us a call. Dr. Champion, if you flip over to the slide before this one, I think it had all our contact information. Feel free to reach out. We'll also follow up with you too as well when we send out the recording, and you can just let us know if there's anything that we could do to help you get some more information and learn more about the Lymphy, because that, Coco, your presentation was wonderful, super, super helpful, and helped address a lot of the questions and concerns that we had from our initial kind of test in the market. And then we had another question from Kayla. This is for you, Dr. Champion. Do you know if the wand tool can be used on different areas of the body?
Absolutely. It can be used on any area that you're using to assess tissue fibrosis. And as I mentioned, for the best comparison, you have to use that fibrometer on an area of the body that does not have fibrosis, and then compare it to an area of the body that does have fibrosis. So again, whichever part of the body you're using it on, just make sure to be consistent in the anatomical points that you're using for comparison.
Okay, we have a question from Patrice. Did anyone in the test group try the LymphyPad to manage fat necrosis?
Not that it has been recorded, but we still have active wear testing going on that they have not submitted their final paperwork. So it's likely that it's getting tested for that purpose somewhere. We do hope to post the wear test experiences kind of in a case study that we can then send out. So once we finish that, Jennifer, we could send it to you for you to distribute, if that helps.
Yeah, no, that'd be great. We also have a question, and I can help address this. What is the approximate cost of the pad? So the pricing of the pad, as it is a made with 100% silicone, it is a premium product, and as Coco sort of outlined all the uniqueness and benefits to it. So the pricing is higher here in Canada relative to some of the other pads that are available. Retail pricing will roughly be in that sort of 300 range, given the quality and the uniqueness of the product. Let's see. So we got some feedback from Patrice. Thank you. This is an informative session and the product looks good. As Coco mentioned, compliance is key. So the fact that it is lightweight, easy to clean, and breathable will go a long way. Dr. Champion, if you can just scroll, I know we had a slide about additional training opportunities. While we're waiting for some of the questions to roll in, I can just quickly talk about those. So there is insurance coverage available for the truncal lymphedema garments that Dr. Champion was presenting on. Lymphedema diagnosis is required, and a prescription will be necessary for reimbursement, or if you want to claim it on your income tax form. Next slide, please. And here is just a summary of the programs that are available. But I will get into our additional training programs for those of you who are interested in learning more and getting additional training. We also offer fitter training programs for mastectomy fitter training, pneumatic compression pump fitter training, and orthopedic footwear and foot care fitter training programs for those of you who are interested in expanding your wheelhouse. So sorry, here's a couple other questions. Have you had folks be able to claim the cost to their medical benefits? It appears to be a medical grade product, so I am thinking this may be possible. So Steph, yes, these are, if you're referring to the Lymphy pad and all the truncal garments, these are all medical devices. They are licensed by Health Canada. So yes, these are considered medical devices, and depending upon whether your insurance provides coverage, you may be able to get reimbursement. So if you're talking about provincial government coverage, some provinces, depending upon where you are located, do provide coverage for these products. For example, Dr. Champion noted that in Ontario, ADP, the Assisted Devices Program through the government, does provide coverage for truncal compression garments for lymphedema management. Private insurance also may provide coverage too as well. So you do need to reach out to the individual's insurance company to understand whether their provider has coverage for these specific devices. But they are all medical devices and also can be claimed for income tax purposes on your tax returns. We also have another question from Kayla. Do you happen to know if AADL in Alberta would cover the Lymphy pad? That's a great question, Kayla. I'm actually still in the process of discussing with them coverage for this specific product. I haven't heard back definitively yet, but once we do, we will absolutely let everybody know what the feedback we're getting from the AADL in Alberta. Dr. Champion, if you can just scroll back one or two slides where it just kind of outlines some of the insurance coverage summary for the country, we can maybe just highlight that for those of you who are interested.
Not allowing me to go backwards for some reason. Give me one moment.
No worries. In the meantime, we had a question from Tanya. Does the ADP program cover the lymph groove? If so, which code would it go under? Tanya, that's another question that we're currently trying to learn more about. This would fall under the accessories kind of category. So we're trying to learn more from the retailers because the product is so new to the Canadian market. We haven't had any retailers or ADP vendors actually submit claims for this product, but we are working with them to try and understand more. But once again, similar to Kayla, we will be in touch with everybody once we have a better handle on coverage in through the ADP program and the AADL programs. Sorry, can you just move forward, Dr. Champion? Maybe one, keep going. I'll tell you when to stop. Next slide. Next. Oh, stop. Okay, there we go. So funding and coverage options which are available. So there are a few categories which these may fall under. So federal and provincial healthcare programs such as the AADL program in Alberta, ADP, SAIL in Saskatchewan, RAMQ in Quebec. These are all provincial programs, and depending upon the program, they cover certain products, such as the truncal vests in Ontario through ADP, the pneumatic compression pumps through Sale in Saskatchewan, and swell spots, which the Lymphepad would fall under. There's coverage there in Saskatchewan. RAMQ provides coverage for the truncal compression garments. Also, a national program is the at the federal level. It's the NIHB program, which provides coverage for the pneumatic compression pumps. I wish coverage was consistent across the country. It is not. It's very regional. But if you do have any specific questions, absolutely reach out to us at Paradigm Medical, and we'd be happy to walk you through that. There's also private insurance coverage for those who have extended benefit coverage. There is, these products are eligible, and you would need to reach out to each individual provider to understand the coverage amounts, what type of documentation is required. Many of them would require a diagnosis of lymphedema and a prescription. As these are all medical devices, they're either class 1 or class 2 medical devices licensed with Health Canada. They do qualify for income tax deductions on your tax returns as a eligible medical expense. Further, because they are medical devices, they are also deemed zero-rated medical supplies, which means that there's no GST or HST. Sales tax is zero-rated with a prescription. So it is varied across the country, and it varies depending upon each individual's provider. So the best recommendation is to contact the benefit provider to get more details with specific coverage, but there is coverage that is available. Alrighty. I guess lastly, if you can just throw up our contact information for Paradigm Medical. All of these products are available here in Canada now. If you're interested to learn more, would like to see some samples, please don't hesitate to reach out to us. We're here for you, and we'd love to either get an email or a call, or we still accept faxes because we still have surprisingly a lot of customers who still like to fax us orders. Don't hesitate to reach out to us. We are the exclusive distributor of ABC products here in Canada. So if you do have anything that you're interested in or would like to learn more about, we would love to help you. Thank you, Dr. Champion and Coco, for your wonderful presentation. It was so informative and helpful, and we get so many of these questions day in and day out, so it's wonderful to have someone with your combination of clinical expertise, also being a patient yourself, and then as well Coco on the product development side to kind of help us all tie that together.
Yeah, of course. This was really fun. Thanks for having us.
Thank you.
So if there's no other questions, let me just do one quick look. Oh, Maybell asked, does the Lymphepad come in different sizes?
It is one size right now. We are trying to decide what the next size should be based off of market feedback. So if you want a certain size, tell Jennifer, and Jennifer will tell us. We are really well known for listening to what our retailers ask for and delivering. So if you provide your feedback to Jennifer and get it to us, we'll do our best to address what you're looking for.
Excuse me. Absolutely. We'd love to hear feedback in terms, whether it be on the product side or just feedback in terms of product improvements. ABC, I can attest to, has been wonderful. We actually had an account just give you an anecdote. She wanted to see, there was a product called the Active Form. It's the product code is 932. She wanted it to come in a larger wet bag. The product is used for swimming, for exercising. It comes with a wet bag, which is just a nylon bag that has a lining to prevent it from to keep it waterproof. She wanted a larger one. So we literally sent ABC the dimensions of the size of the bag that we wanted, that she recommended, and they made it. And now that is the standard size product, which you know they're utilizing. So we'd love to hear your feedback. They are wonderful. It's so important to get you know, feedback from patients, retailers, like the entire community, fitters, because that's how we improve and that's how we get better, and that's how we can, you know, serve the patients and make sure that they're getting the best care. We have another question. Can the pad be cut? Coco?
No, we don't intend for the pad to be cut. I mean, Dr. Champion has told me, like, in her clinical days, that physical therapists get very creative. When they want to solve a problem, they will figure it out. And I understand there are probably some scenarios where you'll want to cut the pad. We don't advise it. The product won't like completely fall apart. It's silicone. It's going to hold the shape, but how long will it last if it's cut into, I cannot speak to.
And we had another question. Is the product available in the US? And the answer is yes. And Coco and Dr. Champion can talk more about that.
Yes, we have about 120 retailers right now that stock the Groove Pad. It's only available through retailers. So we want the patients to go get fitted. Maybe they're getting a referral from their therapist to go to these specific retailers.
All right. Let me see. Is there any other questions? I will give everyone another minute or so. Otherwise, we will wrap things up. All right. So thank you, everyone. We appreciate your time. We know how busy everyone is. So we're so happy to see you here today and investing in yourself and in patient care. If you do have any questions that pop up later after the presentation, don't hesitate to reach out to us at Paradigm Medical. Here's all our contact information. We'd be happy to get back to you as soon as we can in terms of whatever your questions are. And once again, we'll be recording, we're recording this presentation, so it will be available afterwards for you to reference. Have a wonderful rest of your day, everyone, and we look forward to hearing from you soon. Take good care of yourselves. Bye-bye, everyone, and thank you, Dr. Champion and Coco. Take care.